My inspiration to become a nurse was when I broke my arm as a teenager, but it wasn't until I developed a heart condition and was on the patient's side when I decided to become a nurse practitioner. Seeing how NPs took care of me was the driving force for me to pursue this goal. Nurse practitioners have a different way of providing care to their patients. They take care of patients holistically while caring and supporting one's needs. Right out of high school, I started my nursing career as a nursing assistant. I then went on and obtained my associates in nursing, becoming an RN. Most of my career has been in acute care, working in the same hospital for over 20 years. I feel that each step in my career path has provided me with vital knowledge that I have built upon, which will make me a caring, well-rounded nurse practitioner.
Joseph was one of my students in his first semester in the Adult Primary Care Nurse Practitioner program. His motivation, focus, quench for knowledge immediately became evident to me from his interactions with me and his peers. These traits have served him well during the program.
During my nursing research course, team members and I examined the outcome of changing IV catheters only when clinically indicated versus routine replacement. In our review, we found that changing IV catheters only when clinically indicated improves patient satisfaction, reduces healthcare costs, and has no significant complications versus routine replacement. We presented our findings at Adelphi's research conference last year and won for Outstanding e-poster. Medicine is a complex system that always changes, and what I have learned from this project is that nurse practitioners need to be lifelong learners and to treat patients with scientific evidence. It is an honor to have been chosen by the College of Nursing and Public Health to represent Adelphi University in the Sigma Theta Tau International Research Conference in Abu Dhabi this summer.
Mentoring can only successfully occur when both parties are willing to engage. There's no doubt that Joseph is open to as much mentoring that he needs. I see a very bright future ahead of him.
The coronavirus crisis has impacted every one of us. As a healthcare worker working on the front line, additional stresses have been placed on me. Having to worry about if I will contract the virus, spread the virus to my family, and the addition of extra work shifts. It is not easy juggling work, mandates, and school, but my professors have been accommodating and understanding. My ultimate goal is to open up a primary care office in my rural upstate town where I have a farm. This community is in dire need of a medical provider, and I'm hoping to take what I have learned here at the university and bring it upstate to provide care to its residents.